Hello, my name's Danielle Bezic. I'm the manager for the TNA and Preceptorship programme across the Northern Care Alliance.
Hello, my name is Chelsea Dunleavy. I am a registered nursing associate and I am currently a TNA support facilitator across the NCA.
Hello, my name is Amy Crowe and I am a TNA coordinator at the NCA.
Hello, my name is Andrea Martin-Skeech. I'm a coordinator for the Trainee Nursing Associates across the Northern Care Alliance.
Hello, my name is Stephen Leake. I'm a registered nursing associate, currently working as a TNA support facilitator covering the NCA.
Nursing Associate is a new role within the nursing team. Nursing Associates work with healthcare support workers and registered nurses to deliver care for patients and the public. The role has been introduced to help build the capacity of nursing workforce and delivery of high quality care while supporting nurses and the wider multidisciplinary teams to focus on more complex clinical duties. The programme will prepare trainee nursing associates to work with people of all ages and in all varieties of settings and in health and social care. During the TNA programme, you will undertake academic learning 1 day a week and work-based learning the rest of the week. You will be employed in a healthcare setting such as acute, community or mental health, hospital, care home or hospice, but also gain experience in other settings. This will mean travelling to placements and working in a mix of shifts. Requirements of the programme are to ensure that you have received exposure to the 4 fields of nursing. These consist of mental health, children and young persons, learning disabilities and adult nursing. Exposure to various areas such as hospital settings, close to home and at home will also be incorporated into the programme requirements. The nursing associate title is protected by law and the role is regulated in England by the NMC, which means that you can only be employed into the role if you are qualified and registered as a nursing associate. Nursing associates provide care alongside both registered nurses and care assistants in a part of the wider nursing team. The role is designed to help bridge the gap between healthcare assistants and registered nurses. Nursing associates contribute to the core works of nursing, freeing up registered nurses to focus on the most complex care of our patients.
The Northern Care Alliance currently supports the apprenticeship route, which is work-based learning, and the employee is paid a Band 3 wage whilst training at university. The course is funded through the organisation. The apprenticeship route places are usually advertised on NHS jobs. We also support the direct entry route where the TNA funds themselves on the programme and apply for the course directly through the university.
Direct entry TNA students apply directly through the university. The TNA will have to fund the 2-year programme themselves. Apprenticeship route TNAs, the organisation will fund the university aspect of the programme through what we call a levy, and the TNA will also be paid a wage as part of the apprenticeship programme.
Once you've finished your training, you'll have the knowledge, understanding, skills, attitudes and behaviours to work as a nursing associate. Qualified nursing associates can also go on to train as a registered nurse by putting their training towards a shortened nursing degree or registered nurse degree apprenticeship. There are other career progression routes for nursing associates other than training to be a registered nurse. These can be discussed with our CPD team. The NA role is a role within its own rights, and we have some amazing nursing associates within the NCA that have progressed in their careers without completing the top-up R&DA programme.
So the qualifications that are required for applying for the trainee nursing associate role are GCSE Maths and English. These need to be grade C or above or grade 4 and above. If you don't have the GCSE qualifications, then it will be functional skills level 2 in Maths and English. To apply for the trainee nursing associate role, the organisation also asks for at least 12 months healthcare experience. The qualities that we ask for is the ability to communicate effectively with sensitivity and compassion, and to manage relationships with people is central to the provision of high quality person-centred care. We need to make sure that we're passionate about caring for other people while working within the NCA.
The TNA programme is an apprenticeship programme, so work-based learning. This means you will learn on the job and be paid a Band 3 salary throughout your training. Direct entry route will not be paid a wage.
As a TNA, you'll be paid a Band 3 salary. When you qualify as a registered nursing associate, then you will be paid a Band 4 wage.
The organisation will support you to find a post within the NCA. This may not be on the clinical area where you would choose, but we do our best to retain our TNAs and NAs within the organisation. You can apply for your post through TRAC.
It is a 2-year programme at the university where you will obtain a foundation level degree.
The trainee nursing associate role is advertised every 6 months. The recruitment process is for the March and September intakes. It's a long process from applying for the vacancy. Interviews take place and then the organisational recruitment will take place as well. References and DBS checks will need to be completed. Once you have an unconditional offer and all checks have been completed, you will then be required to go through the university recruitment process.
The TNA application process is a very competitive process and we can have up to 400 applicants every 6 months. We will only have a certain amount of placement areas available due to funding, which can vary from 30 to 40 places every 6 months at present. We currently run TNA readiness sessions, which will provide you with the opportunity to learn more about the programme requirements, how to complete the application form, and also how to complete a good personal statement supporting information for your application. You can contact the team via email on tnateam@nca.nhs.uk.